Welcome everyone. Let's tap in again today. This is the second part of my conversation with Judy Tsafrir, who's the author of Sacred Psychiatry and is a psychiatrist. And I want to begin with just a quote from her book around astrology and how astrology is really embedded in her worldview and in her work. So let's start with this quote. This correlation, and that correlation is the planetary movements and what's happening, events on Earth. This correlation contributes to my experience of the cosmos as magical and enchanted, and reinforces my belief that the prevailing paradigm of scientific materialism offers a very limited and partial understanding of the nature of our universe. Astrology is a doorway into the mystery of the universe, or as the gifted astrologer Emily Trinkhaus put it, the study of astrology as an apprenticeship to mystery. And with those words, welcome back, Judy Tsafrir.
Thank you, and thank you for highlighting that quote, because it's something that feels really important to me, and it does really inform the way that I see and experience the world, and is one of the reasons that I love astrology so much.
Because of the mystery component, or why?
Yes, because if astrology, since astrology is so observably, empirically witnessable in our world, and it makes so little sense in terms of our left brain or logic or trying to make any kind of explanation for it that for me feels compelling or reasonable. There's just so much else that we do not understand about the nature of things.
Yeah, there really is. And I guess, yeah, it's interesting actually, because today and a lot in your book is about what we can do, right? In terms of thinking about our health in a holistic way. And here we are talking about the mystery, but there's also something that can guide us from that perspective, right?
Right.
How do you work? How do you work with astrology in terms of client work?
Well, it really depends. Sometimes people come to see me specifically because I am an astrologer and a psychiatrist.
Okay.
But sometimes people come to see me because I'm a psychiatrist and they want to wean from medications, or they are suffering from, terrible anxiety, but they don't want to be prescribed medications. So it really depends upon the way a person comes to me. And not always, but very often, I always get their birth data. Like in my intake form, I ask them for their birth time and tell them that they can often find that on their birth certificate. And on my website, I indicate that I'm trained as an astrologer, and that's something important to me. So I don't always, but I often will look at their chart in advance, or I'll look at their chart in the midst of when I'm doing the initial interview with them. Often it's more meaningful to look at their chart after I've met them, or during the interview. And, I've had patients, like, for instance, I had one woman who is a devout Catholic, and she really, when she called me to set up her initial appointment, she was worried that I would insist upon having astrology be part of our work together. And absolutely not. That is really up to my individual patient if that is something that interests them. But sometimes, a person will come to see me and they're not very knowledgeable about astrology, but they're fascinated with it or intrigued or really would like to know more. And they'll ask me, can we look at my chart together? And
sure. So there are differences
Yeah, very, very different, depending upon where a person is. And, some patients who like are in psychotherapy or even psychoanalysis with me, like that is something that is sort of an ongoing part of our conversation, or they'll say, can we look at my chart today? Like I feel like there's something going on, and so that'll be integrated in
Wonderful.
that way.
Wonderful. Okay, so I'm asking you about this because it's just so nice. I guess it's nice to, we agree about something. That's always like comforting. I have a lot of Sagittarius in me, so it's nice to find fellow people who believe in the same thing, believe in quotation, but also because on a more of a meta level, a lot of people are now, I feel, combining ancient wisdom with something more modern, maybe scientific or something else more modern, and using that for helping people to heal. But a lot of them are still leaving out the astrology because it's
Oh,
still
yeah.
really taboo, right? So I just wanted to highlight that you are in on this secret, this astrological secret. I wonder why that is actually, but no, that actually we talked about that last time. That's because of your father, don't you think?
Well, that is one definite doorway in,
Yeah.
but there's also an awful lot in my chart that has to do with like Sagittarius rising, you know, Venus and Pluto in the ninth house. There's a lot of like spiritual interests,
Yeah.
Mars and Pisces.
Yeah. Yeah, but many people are spiritual without the astrology part of it, which is just fine. It's just my only thing about it is it's because it's been so culturally hidden from us, like something
Not only hidden but despised. Like I
despised.
think Rick Tarnas said it's like the gold standard for superstition and kind of
Yeah,
something to have contempt for.
yeah, exactly. So wonderful that people can have both in you. I want to move on to talk about more into the second part of your book, um, where you are also talking about energy vampires. I thought that's a
Hmm.
great theme. I've been in a dysfunctional relationship for 2 years myself. I mean, and if you want to open it up, it could be like, oh, every relationship is kind of dysfunctional. But I think you know it when there's a relationship where it's like it's really out there and it's not like you're just destroying each other. You have really big fallouts with each other. Um, so I just want to read, you're saying holistic healing cannot occur in this context and you must avoid contact with a person who's mistreating you. And then you also say that rich opportunities for soul growth and development is in our most heartbreaking and traumatic experiences. So can you share with us a little why this is an interest of yours, toxic relationships, energy vampires, and yeah, whatever you want to share about it.
Well, I mean, I'm also not a stranger to toxic relationships. I
Right.
had a very um, difficult second marriage. Um, and, the way in which I empowered myself through um, becoming more self-reliant and standing on my own 2 feet, um, in spite of the fact that I had 3 very young children at the time when I separated from him, was a big source of confidence building and empowerment. Um, so, and like when my first child was born, um, Pluto was on my North Node, so it really was a lot about reclaiming power. And, like one of the things that I think is a common error in the way that people think about, or like people in the field, in the field of like couples therapy. Like, of course, it takes 2 to tango, but it really isn't the case that in a dysfunctional relationship or a toxic relationship that both parties are equally troubled. It really can be that, or equally abusive, let's say.
Okay.
It really can be that one person
Okay,
is really
that
too.
is interesting because yeah, often you'd hear, well, it takes two, and
Of course, it takes two because there has to be two people,
yeah,
but one person can be, conditioned from their experiences in the family to just keep trying to fix something and to try to heal the other person. And
yeah, exactly, yeah,
it's not like they're um, humiliating or being cruel themselves.
but for some reason, because of their own wounding, that's I'm talking for
Yeah,
myself as well here. Because of my own wounding, I could be in that relationship for 2 years, which for me is a long time. I mean, so it was because it took a long time for me after that relationship to see that it wasn't only him because I was so angry with him, but that it was also because of my wounding that I was there.
yes, yes. I mean, you were vulnerable because of your wounding, because of the way in which, you know, you were conditioned in your family growing up to be vulnerable to partnering or being attracted to partnering to repeat something with someone like that.
Yeah, yeah. So
Yeah.
what is it that you teach when? How is it that you see it when you're talking about holistic health and healing, and you say it cannot happen when you're in a relationship like that, but then you're also saying through the heartbreak of that you can actually grow.
Right. Well, like I think very often when a person is in a relationship like that and they finally acknowledge that no matter what they do, no matter how much couples therapy they have, no matter how they twist themselves into a pretzel or try and stand on their head and say black is white and white is black, no matter what they do, that that person is still going to be the way that they are, and they accept that and grieve that and leave, that, then there's like an opportunity for them to empower themselves, to learn through that experience, to see what it was about their growing up that made them vulnerable to that. But I mean, I've literally seen people who, were so chronically ill when they were in a relationship, when they finally freed themselves, like their health just turned around.
Yeah.
It
Okay.
suppresses the immune system to be in a state of chronic stress and fight or flight.
Sure. Especially, if you have all of these fights and you go into those survival levels of the nervous system. Yeah.
Yeah.
Yeah. Okay. Okay. Energy vampire. Do you want to comment that expression?
Well, I think I learned that from Christiane Northrup. I think she used that term. It's just somebody who like feeds off of your energy, who in some kind of way is parasitic and who drains you.
You also mentioned a certain diagnosis.
Oh, I mean, if you're going to be clinically diagnosing somebody like that, it would be some malignant narcissism or sociopathy. It's a very extreme form. And it's a spectrum disorder. I mean, there are people who are self-absorbed and who are inconsiderate and who are kind of like more like all about me. But that's different than somebody who is really malignant.
Yeah.
But it's a spectrum, just like autism is a spectrum.
Okay. Yeah. Yeah, it has been a common thing these days, okay, he's a narcissist and kind of there's some release to knowing that that was the cause of what played out in the relationship maybe. Yeah. Okay. Do you have anything
No,
more?
I have patients who are in those kinds of relationships and they're not leaving. They like due to their religious beliefs or their psychology, they just cannot bring themselves to leave. You know, that's what they've just decided to live with.
Yeah, yeah. I mean, you left your second
Yeah,
marriage. Yeah.
yes.
What did it require of you to leave?
I think to accept, when I finally accepted that no matter what I did, no matter how much therapy we had, no matter how I accommodated or denied my own reality to try to keep the peace, to try to make it better, that it wasn't working. And when I saw the ways in which it was damaging to my children, you know, that I just couldn't stay in it. And despite my fears, which were considerable about, you know, being a single parent and managing everything on my own, I knew I had to do it.
Yeah. Did you marry again?
No,
No. Okay.
no. I'm cured.
You're cured of that.
I actually really enjoy being single.
Yeah.
I live with my best friend, a woman,
Okay.
and that is a really wonderful arrangement.
It sounds like it. Yeah, that sounds
Yeah,
really wonderful.
I have companionship
Exactly.
and a friendship, and she has a skill set that I don't have. She's extremely handy,
Okay,
and
good.
so it's a really wonderful arrangement. And I mean, that's something that I think about, you know, that I think it's possible to have all kinds of living arrangements
Yeah.
that are not necessarily marriage, that can
That can
be
fulfill
very
you.
supportive and fulfilling.
Yeah. Yeah. Nice. Okay, inspiring. Okay, so I want to hear you about, we're just changing topics a little bit here, but the limbic system in the brain. Just anything you want to share around it, and what we also I want to go into is also like, what is the cause of all of these symptoms? Because of course it's going to be different, but just how you work with finding the cause when people come with, "Oh, there's this and that." There's so many things. Every time I'm at a new alternative healer, and it'll be something quite particular when I come, but then they of course ask, because they do work holistically, and I'll be like, "Oh, there's also my neck. My neck tends to hurt. Oh, also, my digestion." And then there's so many things, right? So how you work with finding the cause, and also anything about the limbic system that might be relevant.
Well, I mean, I think that's interesting that you put those things together, because I think they're very linked.
Okay.
You know, like one of the most consistent recommendations that I make to people who come to see me in my practice, no matter why they're coming to see me, is that they engage in a systematic practice and program of limbic system retraining. So, like, the way that I see it is that everyone in our culture at this point in time, or I wouldn't say everyone, but most people are in a state of chronic sympathetic arousal, chronic fight or flight, because there's so much fear in the collective because of the amount of change and the accelerated rate of change that is going on, and all of the uncertainty. Like, people are really feeling it, and they're scared, and they might not even know that they are in a state of chronic fight or flight because they're so used to feeling that way. But when you are in that state, you are secreting a lot of cortisol, and that is inflammatory. And what is very, very important for healing of all kinds of conditions, including depression, anxiety, but also, conditions that appear to be more physical, like digestive system problems or brain fog or um, skin problems or uh, joint pain. Is the common denominator is like inflammation. And so there's a relationship between the limbic system and inflammation in the body. In the immune system, there are white cells that are called mast cells, and they have granules that contain bioactive amines. And when they are everybody has them all over their body. There's the highest concentration in the areas that interface with the environment, like the lungs or the digestive tract. But we have them all over our bodies, and when they're functioning properly, they orchestrate a nice immune response if there's any kind of pathogen or any kind of threat. But when they're dysregulated, they start releasing their substances in a chaotic, uncontrolled manner, and that causes inflammation. And so and when there's all those substances, it stimulates the limbic system, which is in then some kind of state of stress and fight or flight, and activates the sympathetic nervous system. And so there's like a feedback loop between the two. So you calm down the limbic system, you calm down the immune system, you calm down the immune system, you calm down the limbic system. And so, I mean, I actually believe that it's more important to calm down the limbic system, that's more at the heart of so much illness than like chasing down all kinds of other physical causes.
And to calm down the limbic system would be psychotherapy, I guess, because it's that emotional.
No, well, that also can calm down the limbic system, but like I these days I refer my patients to a particular program practice that is available on the internet called Primal Trust, and it's like a membership, and it's so amazingly well constructed. There's tons of like education videos about the nervous system and about nervous system retraining, brain retraining. But then there's all of these practices like breathing techniques and eye yoga and different things that calm down your nervous system and that you can practice. And they also offer daily classes that people can join in, and it's possible to become a member of a small group that meets regularly to just for community support and to talk about what's going on in their lives and also to talk about the practices, but they are forbidden to talk about their symptoms because so many people who are chronically ill, that takes up so much space. Like I have these patients that all they want to talk about is, one physical symptom after another, and their fear that they're never going to feel better and what supplement they're chasing and what dosage, and it just increases all their anxiety.
Yes, I can really nod to that one. And I guess it's just habitual that one part of it is, I guess, habitual, and it's also because people really want to be understood in their pain. So
they're suffering terribly.
Yeah. So to have someone else to hear it, but having worked I also work in social work now, but another kind of social work where I would like be a mentor for people who had a hard time. There was a lot with chronic disease, and I would during one day get so many descriptions of exactly how it hurt, when it hurt, and all of that, and it was just really hard on me as well. It's hard to bear that. So I think that's a really good principle to let's try not to talk about it. But again, I understand why, and I think it's referred to something you say in the book, because you talk about how it can be really invalidating to be told by the doctor that, oh, it's just stress, so there's nothing wrong with you, whatever. It's like that we can't find anything. And so that is just even more, fuels the
Oh,
need to
that
talk
is
about it.
such a common story with people who come to my practice, because I'm usually not the first stop, like they've seen a lot of other doctors before they meet with me. And that's such a common experience, and also such an experience of relief where I'll say, wow, like I'm wondering if you have mast cell activation, and there is a protocol for, calming down the mast cells. There are supplements and treatments in addition to limbic system retraining that can help the mast cells calm down. And there's also like a connective tissue disorder that's called Ehlers-Danlos syndrome that is so common and so underrecognized. And those people are very prone to having mast cell activation and lots of psychiatric symptoms. But the reason is because they have this connective tissue disorder that is predisposing them to, leaky gut, leaky brain. They have a lot of physiological things going on, or they may have something called POTS, postural orthostatic hypotension. So if they go from sitting to standing, their heart rate may like increase. They're autonomically dysregulated, and then when your heart rate increases, you feel really anxious. But you're not like you're anxious because you're having a conflict about something or you're afraid of something. It's like your body's going crazy. And so it's just those people who are on the Ehlers-Danlos spectrum have seen lots of doctors and have been, frequently referred to psychiatrists because they're told that they're anxious. And they are, but
for other reasons. And then
yes.
you say that then they are prescribed
Yes,
medicine,
yes, very often, very often.
and it actually can worsen the symptoms.
Well, sometimes that can be helpful initially, and sometimes that can continue to be helpful. But if they ever want to try to get off of it, that can also be a huge story, because people get extremely dependent upon the benzodiazepines as well as some of the antidepressants. And they're just not a free lunch. And it's just so much better to look for the root causes and to address the root causes.
And so what could that be, would you say, when we're talking about
The
chronic
root
disease?
causes?
Yes.
Well, like mast cell activation, which in some ways is a final common pathway. So in some ways, it's not a root cause because it can be due to mold toxicity. It can be due to chronic Lyme disease. It can be due to a car accident, trauma. It can be due to a divorce. It can be due to a death. Like any kind of like extreme emotional dysregulation could set off mast cell activation in the body. Or somebody could have Ehlers-Danlos syndrome, and they are just simply prone to having these kinds of dysregulations, and that you need to treat it.
Okay. Okay, I think I get that. So it's mast cell activation is per definition, would you say, behind this, and then something else is behind mast cell activation?
Usually, yes. I mean, like that's my take on it. I think a lot of long COVID is mediated by mast cell activation.
Okay.
But there's a person who's probably the greatest expert on mast cell activation, and he is not interested in looking for the underlying cause. He just treats the mast cell activation. But the way that I was trained was to look for the underlying cause.
Yeah.
As much as possible.
Yeah. Yeah. That does sound like a good idea. to go into that. I guess if healing can happen without, that's fine, but usually it just shows up somewhere else in our lives if it's not dealt with. Yeah. Okay, Judy, the last segment I have here on my list is Chiron / divine timing. So that's the last part of your book. And we did touch about Chiron in the last conversation as well. But whatever you feel inspired to go into around this topic and why it was important for you to have it as part of your book.
Well, I mean, it's been really striking to me how often patients come into my practice at the time of their Chiron return, when they're 49, 50. I mean, for women, that marks a time where it's sort of the end of their reproductive life, and they're hormonally shifting into another stage. But for both men and women, mortality comes into view in a different way. And also the signification of Chiron, very often people, their core wounding comes into focus in some kind of way. And so it's a great time to get into therapy to deal with whatever it is that is kind of at the heart of the matter for them. Like that, when I finally decided to leave my marriage, when both my parents also died in that same period, was that my Chiron return. And so like the whole issue of divine timing is such an interesting one. Like I think that kind of things happen in a certain way when they're meant to happen, when the time is ripe and right. I recently have a new patient. She gave me permission to talk about her. Okay. She came in, she's like 38, and it's like her Pluto square. So that's also another kind of core time when there's like a possibility of dealing with kind of core wounding. So it's, and I mean, people come in around their Saturn return, right? Both the first and second one. So there's or their Uranus opposition, like there's these developmental passages that are so predictable and characteristic, and in many ways like correlate with the Ericksonian stages of psychological development. Like there's like Erickson like laid out certain, or there's another person, his name is Levinson, and he wrote a book called The Seasons of Man's Life, and he didn't like correlate it with astrological events, but noticing that over the course of a lifetime there are certain passages that people go through at certain times. And so I think it can be helpful for people to connect the dots in that way, and to know that this is what is going on in the heavens, and that this is often experienced on Earth in this particular way, and that it doesn't last forever. Your Chiron return does get over, like it doesn't continue forever. So yeah, I don't know what else to say about that.
No, I'm inspired to point back to in the beginning where you were sharing that you have clients who come to you for astrology, you have clients who don't want to go into astrology, and sometimes it's like it's the same thing, right? It's just astrology is just showing us what now psychology has figured out. We have someone in the background. Is that your roommate?
Yes. Yes.
Okay,
yes.
that's nice. Anyway, I was distracted. Who's that? Yeah, because it's like you're saying, it's the same phases. At least it can be reflected in the astrology. It's really fun. I studied to become a psychotherapist, and we do that a lot. Work with different ages, because that's so natural with different developmental stages. That's just so universal. You can't really
universal.
Skip it. Yeah.
Universal. Yeah.
Yeah. And so it's so fun to think about what we know from the astrology that means. It's like another layer or another dimension is added. But of course, if you're working with clients who don't want to go into that, it's not needed, because we have the psychology, right? So yes. Yeah.
Depending upon their orientation, they may find it like a good container to talk about it through an astrological lens, or that's not something that speaks to them and would be alienating,
Yeah. Yeah, and I'm also thinking about as we speak today, and it's probably gonna come out just really soon. We have the Sun conjunct Chiron.
Absolutely,
So
at the full moon.
yeah,
At the full moon. Yeah. I've been giving that a lot of thought. The Sun conjunct Chiron at the full moon in Libra Aries, like just some kind of opportunity for releasing any way in which our familial conditioning is contributing to the way that we think about ourselves, or the way in which we're in relationship with others, that inhibits us from shining our light into the world.
yeah, that's really good. And apropos those woundings we were talking about before, that could potentially show up in a big way, be reminded of them, having to take action on something related to, to do with a core wounding. I was thinking something like that.
Mm-hmm.
I mean, it's continuous, isn't it?
Yes, I don't think that we ever kind of arrive. We're always kind of learning more and growing more and evolving further.
Yeah. I feel like asking you here in the end, we've had these two conversations, I feel like asking you to reflect a little more on with us around what that sacred dimension is.
Mm-hmm.
That sacred psychiatry. What is the sacred dimension to your work? I mean, here we're talking about it as you can talk about astrology and you can not talk about it, but it's still going to be there. That's, I guess, one very practical part of it. But there's something more to, maybe it's also related to what we're talking about.
I like that question a lot. I mean, it goes it sort of goes to my heart, that question, like recognizing the divinity in my patient, and helping them recognize the divinity in themselves, helping them recognize the divinity in the world around them and connecting with that. I just think that an awareness of that dimension of experience is so missing from our conventional culture, and is so much at the heart of what ails us all, this kind of alienation, not recognizing our, interconnectedness and with each other, with the natural world, with the cosmos. And that leads to a lot of loneliness and meaninglessness.
Feeling of being separated, apropos with the Chiron and Aries, a feeling of separation there. And the illusion of that. I like that answer a lot. I really like that answer. The divinity, that says it all. Yeah, that says it all. That's the part where you leave that out, then you can get stuck on all the symptoms. But if you really accept that we are powerful beings, right, and there's more to our lives, there's more to our purpose, then that does a lot for, the whole treatment plan, if you will.
Right, totally. It uplifts, it expands. It's deeply, deeply meaningful and powerful.
Is there anything you want to end by saying?
Just how much I appreciate you and the thoughtfulness and care with which you read my book, and the great questions that you asked, and just honoring you.
Oh, thank you. Thank you for that. Thank you. I feel like saying something again. I feel I've spoken a lot today, but it's just because I'm really into this field, I guess. I'm just glimpsing at my notes, and I remember also reading in your book that medication, which is so big in psychiatry usually, can also numb the abuse that's going on. We're talking about in a relationship, but in a life in general. So that's just a little nuance there in terms of what it is that we fill ourselves with. And that's something that I've taken away from reading your book is definitely being more picky around what is it that I take in, for me especially around nutrition. But in general, that there is a lot that we can do to honor all of us, right? Yeah.
Right. And before we started recording, I can't remember exactly what we were talking about, but there's this expression, trust in God, but tie the camel. So tie the camel is like, doing what is within your control to contribute to your health and well-being, like having nutrition that is supportive and healthful, and doing spiritual practices, and getting proper sleep and movement and all the things that are within your control. That's tying the camel, But then, the trust part is then like surrendering and having faith that that it's unfolding as it's kind of meant to unfold.
Wonderful. Yeah, I feel that sums it up, actually, what we've been circling around today, for sure. Yeah, I remember, I just noticed that you mentioned sleep, getting your sleep. I just had a few nights where I couldn't sleep, like full nights, and went psychotic. That's a little big word, but I just really lost it, and it just reminds me, I can't do any work, I can't rely on myself if I'm not physically taken care of.
Right. It's just fundamental. It's taking care of the vessel. It's so foundational. And if people don't take care of their bodies in an appropriate way, there's no foundation for spiritual expansion.
Mm-hmm. Yeah. Good. Exactly. That's the same with the relationship. If you're in a toxic relationship, then we can't really work on it. Yeah.
Right. Okay. It's all interconnected.
Yeah. Yeah. It really is. Thank you so much, Judy Tsafrir. Maybe one day I'll learn to say your name correctly, but let's not have too high hopes around that. but thank you so much for sharing your wisdom, sharing your book, and being generous in these conversations with us.
Thank you, Mama.